Hello. First of all, apologies for not being present there physically, but I'll be joining you soon. So, I'll be speaking upon single bundle versus double bundle PCL reconstruction, when and why. When you look at the anatomy of PCL, we all know that it has consist of two bundles and it covers wide area on the femoral condyle in the intercondylar notch. So, let's look at the anatomy. It is as thick as that of ACL. I mean, it's twice the thick of that of ACL. It acts as a secondary restraint to and resist in varus, valgus, and axial rotation movements. It originates from the anterolateral aspect of the medial femoral condyle and goes down and inserts along the posterior aspect of the tibial plateau, almost 1 to 1.5 centimeter distal to the joint line, as shown in these pictures. And when you look at the detailed anatomy, there are two distinct bundles of the PCL. The anterolateral bundle, which is a larger, the posteromedial bundle, which is smaller as compared to anterolateral bundle. And the distance or footprint distance covered by this bundle is on femoral side it is almost 12 mm, and while tibial side it is almost 9 mm, as shown in this picture. And when we look at the biomechanics of the PCL, the anterolateral bundle acts during flexion, and while posteromedial acts during the extension. So in flexion, what happens? The anterolateral bundle which becomes tight and posteromedial bundle gets relaxed, while in extension it's vice versa. The major strength of the PCL is given by the anterolateral bundle, because as we know it is the bigger and stronger bundle amongst the both. So the next question is, do all PCL tears need surgery? The answer is no. The grade 1 and grade 2 can be very much managed conservatively, but the isolated symptomatic acute grade 3 PCL tears, if there is a combined reconstruction in multi-ligament surgeries, if there is associated meniscal body or root tears which you are planning to repair arthroscopically in acute setting, if there is acute displaced bony avulsion of PCL, then all these can be managed with surgical reconstruction, and so is the chronic symptomatic PCL tears. So there are various published outcomes of PCL reconstruction which are not as favorable as ACL reconstruction in the literature, because of the surgical technique which is a little cumbersome and familiarity of the same procedure by the surgeons. There is a variability in surgical procedures based on graft selection, fixation methods, then placement of these tunnels, number and location of the bundles, then tensioning protocols for each different bundle, and post-operative rehabilitation programs. So based on that, there is quite a lot of variability when you plan to do PCL reconstruction as compared to ACL reconstruction. So when the single bundle PCL reconstruction is being considered in acute setting, if there are combined PCL injuries like PLC, PCL or PMC, or in knee dislocations, that time you may consider doing PCL reconstruction as a single bundle PCL reconstruction. Then as again in acute or chronic PCL injuries in which both the posteromedial bundle and meniscofemoral ligaments are intact, so these type of injuries also can be managed with the single bundle PCL reconstruction. When do we suggest to do double bundle PCL reconstruction? When all three components of the PCL complex, that's anterolateral band, posteromedial band, and meniscofemoral ligaments have been ruptured, then the patient is a candidate for the PCL reconstruction. Why do we advise single bundle PCL reconstruction? Because it is very simple procedure. Clinical outcomes are comparable, as there is a conflict evidence, but there is no significant difference between clinical outcome of single as well as double bundle PCL reconstruction. We will come to it later. Then it is very much cost effective, less inventory, less implant, rehabilitation is easier and faster, though there is a lack of definitive evidence which is in support of double bundle PCL reconstruction. So that's the reason why single bundle PCL reconstruction is recommended. When do we do double bundle PCL reconstruction? When we want biomechanical superiority because it helps in restoration of knee kinematics and it controls the posterior tibial translation. And when we follow the variable tensioning patterns based on the distinct fiber orientation and tensioning of the two bundles of the PCL during the range of motion exercises. And when you look at the clinical outcomes, there is no clinical superiority as compared to single bundle PCL reconstruction, though it is more anatomically accurate to get the knee function back to its normal. So let's see what the literature say. So this meta-analysis has very clearly stated that both methods could restore knee stability and motion with satisfactory short-term patient reported outcome measures. So there is no much difference. Then this second study between single and double bundle 10-year follow-up, no clinically different result between two groups. Then another systematic review. This biomechanical study has clearly showed no significant difference. Then another systematic review and meta-analysis, there is no demonstrable difference between both. Then Korean study with 10 years follow-up after single and double bundle, they have very clearly stated no significant difference between single and double bundle PCL reconstruction. Study by Nikhil Verma and group, they have stated that double bundle though provides better post-operative knee stability, but the effect on clinical outcome and risk of graft failure was not found to be significant in both these groups. So there is hardly any difference between two groups. Then study by Laprad, they have stated that there is a improved patient reported outcomes and knee stability by both single and double bundle, but the knee scores were slightly better as compared in double bundle as compared to single bundle. Then another study by the Jorge Chahala group, that double bundle PCL reconstruction leads to superior biomechanical outcomes and clinical outcomes. Then this another study, there they have shown the conflicting results with respect to effect of the single and double bundle reconstruction. So still we have to look at what are the advantages of both the procedures and choose depending upon patient and your choice. So single bundle PCL reconstruction is simplified. It gives faster recovery. It is less invasive, lower risk of complication, and cost effective. But when you look at the double bundle PCL reconstruction, it gives improved stability. There is more anatomical restoration, enhanced kinematics, and reduced risk of graft failure, and potentially better functional outcome. So this is another pictogram from the arthroscopy journal. Well, they have very clearly stated PCL bundles, ALB restrains posterior tibial translation, posteromedial bundle restrains internal rotation, co-dominant synergistic relationship exists between these two bundles. And when we look at the single versus double bundle PCL reconstruction, similar functional outcomes, better objectives outcomes than the single bundle in double bundle PCL reconstruction, and outcomes can be similar to an ACL reconstruction, can withstand the effect of a flat tibial slope, and decreased tibial slope increases PCL graft forces. Thank you very much for your kind attention, and thank you very much for this warm invitation.